Today I'm discussing an extremely important topic concerning health apps and heart health apps on your smartwatch. A word of caution, if you completely rely on these apps, you might be in trouble if you do not consult your doctor. The reason of this is because I have seen a few patients where the diagnosis has gone completely wrong when people relied on these watches to diagnose a problem. Did you know that smartwatch has a heart rate monitor, can also take your electrocardiogram? Yes, you're right. It takes an ECG of a person, not the full ECG, but it takes a single lead, which is enough for diagnosis for a few conditions. A lead is basically two poles. So ECG works on the pole system. So it has to measure the difference, the electric difference between two poles. So in these poles are our limbs and the chest. So when you wear a watch, you're basically using only one limb. So one lead which is there is not enough to diagnose conditions beyond palpitations. A single lead may not help you diagnose, for example, an ongoing heart attack or myocardial infarction. For that, at least we need limb leads and chest leads. Smartwatches actually are not entirely accurate, but they can give you a direction, a predictive direction, as in where are you headed. You cannot completely rely on it and expect you to give you perfect answers. So for example, at times you've climbed, say, 6 flights of stairs, and you know that. But your smartwatch may say 10 flights of stairs, because it basically relies on your arm swing when you're walking. So if the arm swing is less or is a bit too much, or if you're on an escalator, at times it cannot judge the height. But you at least will get a direction of what to do. These apps are at the present good for diagnosing arrhythmias. You can save a life. Because for example, a patient is far away in a remote area and he has no access to a quick ECG. But if he's wearing a smartwatch and he can manage to send you that ECG, so you will at least be able to diagnose a non-life-threatening from a life-threatening rhythm problem. And if it's a life-threatening rhythm problem, you can direct him to the nearest hospital and what medicines need to be administered. So at the present moment, I would use it for diagnosing arrhythmias in some patients. And the other thing which I have noticed with these technologies, there's something called heart rate variability. Heart rate variability is assessed by measuring beat to beat or heartbeat to heartbeat variation. So a high heart rate variability suggests that you have better cardiac health, and a low heart rate variability suggests you have poor cardiac health. So using a smartwatch, I'm sure heart rate variability will be able to be calculated in future. So all these apps do not diagnose anything beyond arrhythmias. So it cannot falsely detect any heart attack, because it will not say anything about a heart attack. It just talks about rhythm problems. So it will tell you something like normal sinus rhythm. That means your rhythm is normal. Or it will tell you atrial fibrillation, whereas you have irregular heart rate, which can cause problems of clots in the blood vessels, clots in the heart, which can spread into the different body organs and cause problems there. And rarely it can diagnose life-threatening ventricular arrhythmias, which happen with heart attacks, where the heart rate goes extremely fast to 180, 200, 220. But these are not foolproof at the moment. By the way, if you're liking this video, don't forget to like and subscribe. The ECG app in the smartwatch is evolving. I would not say it's accurate. I would not say it should be used. And the companies always put a disclaimer that this is not for use to diagnose medical conditions or to take any action based on that. But I can give you a couple of examples where a smartwatch has really helped me with patients. So for example, I had a patient who kept complaining of palpitations, irregular heart rate, and whenever he reached me or the hospital, the electrocardiogram was normal. And these episodes were far in between. So for example, if you put a long ECG monitoring, so you can put an ECG monitor for 7 days, 15 days, 1 month, even for 3 months, 6 months. So that's impractical, expensive, and may not yield an answer in a person who gets, say, a palpitation once a year. So this person was having these complaints, and whenever we put a Holter, which is the ambulatory ECG, for a long time, we would never pick up anything. And one fine day he said, I'm getting palpitations, and he called me. I just told him, do you know how to take the ECG on the smartwatch? He said, yeah, I can try. And he sent me the ECG. And bang on, I knew what rhythm problem he had. I just called him to the hospital, and we got him fixed. And now he has no rhythm problem. So here, it helped me. So at the present moment, a properly taken ECG during rhythm problems can help diagnose rhythm problems, but it will not diagnose beyond this. So at the moment, but with evolving technology, and if they can manage a 6 lead or a 12 lead ECG, or even a 3 lead ECG, then we may be headed towards diagnosing more heart conditions wherein the patients can coordinate with doctors telephonically, electronically, and can be referred to nearest centers in case these diagnoses get accurate. Why am I discussing about this in this video? I want people to realize that smartwatches, if used properly, can help you with your heart health, but do not follow it blindly. Always coordinate with a healthcare worker or a doctor to validate or invalidate what the watch tells you. If you like technology videos like this one, I have a video on ChatGPT that you might like. See you next time.